Good afternoon. I'm Terry Scoggin, the CEO of TRMC in Mount Pleasant, Texas. Today's Wednesday, January 20th, and it's time for our COVID-19 update. When I left Friday and things were increasing and going into the weekend, they continue to increase. And as you look at the numbers and we start talking about the Northeast Texas region, you can see where we were 232 end of last week and 226. And then on Sunday we hit 210. And, I was excited about that. We watch these numbers on a daily basis. And this is our region from Sulphur Springs all the way to Paris, to Mount Pleasant, to Texarkana. And when we saw the numbers Sunday coming in, we're excited about it. The problem we started seeing was Sunday night, our ER started getting overwhelmed. And it wasn't the numbers on Sunday night, it was the acuity, how sick the people who were coming in. It was one of our toughest nights through this whole pandemic was Sunday night in our ER, just due to the sickness that was on the floor from COVID-19 and also coming into the ER. We had to transition quite a few people that night, hold them in the ER and try and make rooms in the patient tower to take care of them. We actually had to build 3 new rooms on Monday and increase our capacity to 26 beds now from COVID in our hospital. So that is our highest, and we hit that on Monday. The good news is, as of today, we're at 20 beds, down from that 26 to 20 COVID patients in the hospital today. So that's good to see. But you can see from a regional perspective, 236 we hit on Monday, on Tuesday. But ICU is going down to 68, so that was good to see. So maybe that 78 peak last week that we saw in the ICU and 79 a couple of days before as we go down to the 68. When we look at the reason I switched my charts up today was this reason. When you look at Monday's chart, these are a day late from the numbers that we're seeing that the state puts out. The beds is a percentage of total beds in the region. Now, you remember under GA 31 if you're above 15%. We've been above 15% since December 28th. But if you look at this, you got to get excited because you see for the first time that dropping and going down. But that's a day behind us. So I expect when the numbers come out tomorrow morning, we see those, you'll see that increase of 236 for the region as a percentage, and we'll go back up there. And probably our highest percentage to that point. So we're watching the beds in the region. Hopefully everybody else continues to go down. On the positive side, when you look at our counterparts south and west of us, Tyler has seen, if you go back from January 11th of the last 2 weeks, that continued decline. Not huge, but it's a continued decline, almost 10% when they hit the 19th, where that was our largest yesterday. They've gone down to 588. Now, their ICU beds have stayed high. So even though the number of people in that area in hospitals have gone down, the acuity is still up there. You can see that. Also, what we're seeing in Dallas as well, to the west of us, you can see that drop in the hospital beds of the 11th at their peak, down to 3,800, but the ICU beds have stayed pretty consistent. So the one thing I just want to make sure everybody understands is this is still real, and we're seeing quite a few sick people. I'd be surprised if you did not know somebody in your inner circle who has COVID. Be surprised if you don't know somebody in your inner circle that's not in the ER or in the hospital over the last week. This pandemic, this disease is touching all of us, and it's our friends, it's our families. My text and cell phone blows up on a daily basis and questions that are being asked. So the one thing I want to encourage for each of you just to understand is if you start showing symptoms, don't waste time. Get to your PCP immediately. Call your doctor, call the family care center to try and get in there. If you can't get in and you're getting sicker, do not wait to go to the emergency room. This disease cannot you just can't put it off and say, too many of my friends have said, I'm just going to man up and work through it. This disease is not like that. And I can't tell you why you're going to react differently than someone else. I've been following my mom for the last 2 weeks as she turned positive around the 10th or 11th, and she positive. And if to see Dad, she gets tested every 3 days, and negative for months. And then all of a sudden, wasn't feeling well on last Monday, we took her in, and she was positive. And so been watching her for the last 10 days, and it's kicked her butt. I mean, there's no professional way to say it. She's had all the medicines, and Dr. Cannon, Dr. Burrows, everybody, Dr. Thurman, have done a great job of monitoring through the family care centers. She gets her call. She said several times they've asked her, you want us to stop calling tomorrow? She goes, no, I like talking to you, and I like hearing your voice, and you're happy. So, but she's just been worn out, and going from the bed to the chair has been tough for her. And then I got a text a few minutes ago saying the best thing I've ever gotten her in the last 5 years when I brought her Gatorade yesterday and left on her porch, and how great the Gatorade felt. So this disease is bad, and I just want to encourage you, please don't waste time. Please don't take a chance. Get to the doctor, get in, and make sure you're getting the treatment that you need. From a vaccine perspective, we did receive our vaccines yesterday. We were expecting on Monday. Our second dose is 700, and then another first dose of 400. You can see this map, and all this information is out there on the state websites. And I'm a big data guy, so I follow this closely. But you can see where Titus is, and we're blue, received over 500. And to this point right now, we're up to 1,400 total first dose vaccines that have come our way. And right now, this is another screen that's out there that shows who has vaccines in the area. And you can see that blue dot is Titus Regional. We did receive 400 yesterday, and we are getting those out. We started calling them this morning. Supposed to arrive on Monday. It was a day behind. And so when it finally arrived yesterday, we were thankful. We started giving out the second dose to our physicians and first responders who were in that first dose a couple weeks ago, 28 days ago to be exact. Started giving that out. But we also started giving out today the next 400. We're using this waiting list. And I know I'm getting a lot of questions about where I am on the list and how many. I will tell you the waiting list has over 4,000 people. We are, by the state's requirements, are parsing out 65 and older, and it's based on where people are in line of when they got in and registered. And there are some people who said, well, I got my birthday wrong on that. We've sorted that data 100 different ways to try and get people's birthdays right and make sure it's looking at it right and getting that information out. But we are going through that waiting list, and as soon as the state gets it, we're trying to get those vaccines out this week, that same week. So we're making progress. I talked to Michelle a few minutes ago when I was on my way over here. They've given out over 150 or so before noon today. So right at 100 and about 2 o'clock, about 150. So they're giving them out and getting them out quickly. We are calling people down the list and trying to get people in. So I encourage you, if you've not put your name on the waiting list, please get out there. Also follow the state's website of where other places are, whether it be the Brookshires or the other pharmacies or some other providers. I just encourage you to try and find those places and get on as many lists as possible to get that vaccine. The more the state gives us, we'll give it out. We're working closely with the state. We've been unable to get a larger hub like we wanted. We were hoping to get maybe a 500 shots a day type scenario instead of 100 shots a day. But we're continuing to work with the state. So I would encourage you to get on as many lists as possible, and we will get to you. Everybody who's on there, we'll get those. As soon as we get in, we're getting it out, and we're going down that waiting list as of right now. As we finish and we start talking about Friday, I just encourage you to continue doing the things we've been doing. Continue to fight it. As we start getting our first group of people with their second dose and we start getting the antibodies out there, there is a light at the end of the tunnel. But until we get to that point, I do encourage you to do your best to quarantine if you show symptoms, wear your mask at all times, wash your hands, and continue to be smart about how you social distance or how you integrate into groups. We're not through with this yet. And it's amazing to me that we're 10 months in now and we're seeing our sickest patients right now. The people that we're seeing on the floor are our highest acuity that we've seen. And we're seeing people at their worst right now from the standpoint. But I want to give a shout out to our physicians and our clinical team. Even though that we're seeing our worst in Titus County as far as the numbers and the beds, our mortality rate has remained low. And what our physicians and clinical staff have done to make sure that they're giving the best possible care for the patients in this region is phenomenal. I'll put up what our team has done versus anybody, not only in this area, but the state and in the United States about the treatment of the COVID patients in our hospital. I sit on quite a few calls. I sit on quite a few meetings. And what the doctors and the clinical team and the respiratory therapists and the nurses, the physical therapists, the EVS, the nutritionalists, everyone involved in the care of those patients that they're doing is phenomenal. And they're giving the best treatment that is available from a technology standpoint that we have and just from a good old doctor care. And I just want to thank our physicians and our medical staff for their leadership and what they've done. And I promise to this community that the treatment that they're being given to these patients is just phenomenal and it's first class. Thank you for support of our health system. God bless.